Welcome to my week 11 and 12 update of Ramsey Hunt Syndrome. I've got a lot to update since this is a 2-week update. I'm going to talk about why it's taken me 2 weeks to do an update from pushing myself too hard. Give you an update on vestibular therapy or balance therapy. Give you an update on the eye. I did 2 big tests, a nerve test and an MRI. I'll give you insights from those. I'll share some learnings and feelings that I'm experiencing. So, why did it take me 2 weeks to do this update? Well, at the end of week 11, I decided I'd go camping in my RV, went with some family, and I kind of wore myself out. I didn't completely break myself, but I was so exhausted for a couple of days. I usually do these updates on the weekend. I went on the weekend and I didn't really recover until well into week 12. So by the time I got to a point where I felt like recording, I was like, well, I might as well just do a 2-week update. That was good. I was able to go out. I really pushed myself. I didn't get in the water. We went to the lake, but I did pump up some paddle boards and a kayak. Really exhausted. There's a lot of in and out even with an RV camp. But I got through it, and I guess that's progress. I've been walking a lot more. I've also continued to lift some weights. Haven't done any serious cardiovascular exercise yet, but I'm making some progress there. And I'm getting tired because I'm doing these things, but it's a good tired. So I'm trying really hard not to go over the limit, but I'm definitely hitting that limit occasionally. Let's talk about my vestibular therapy. I did 2 more sessions. I'm going once a week. In week 11, I did a test. It was scored from 0 to 30. I scored a 20. Anything below a 22 was considered risk of falling. My guess, if I were to have been scored at the very beginning of my illness, I bet I'd be well below a 10 because I was really sick. Now, ironically, I went in right after the weekend of camping at the beginning of week 12, and I actually scored a 25. And my therapist was like, wow, you made great progress. And I was like, that's crazy because I'm really tired. I wore myself out this weekend. And he was like, well, keep it up. Keep pushing yourself because it's definitely helping with the progress. All right, some more updates. At the end of week 11, I went and saw my ophthalmologist, and he gave me the best bill of health yet. He said my eye's looking really great. We're going to go to every 3 weeks, or at least I had to go to a 3-week check-in because I've got some other things going on that prevented me from getting there. But that's good news. My ear, nose, throat doctor was strongly suggesting a gold weight. My eye doctor said, hey, if your eye wasn't doing as well as it was, that might be good. I am surviving by wearing this goofy thing. And it is goofy, the moisture chamber, but man, it works. And so I'm kind of okay with the goofiness because it gives me comfort and relief. And I'm not interested in getting a whole lot more procedures unless necessary. So we'll stay steady with that. I'll take this off for now. I don't want to freak you out. Although that's how I usually look. I wear that pretty much all day long. But I'm trying to put a little bit nicer version of myself in these videos. I did an interesting test in week 11 called an ENOG. Let me see if I can read this word. An electroneurography. Essentially, I should have got a picture, but I'll use this image to show you. They put sensors on my face and they stimulated each side. First, they started with my good side and they stimulated the nerve branch that goes to my mouth. Now, the nerve to your face branches to multiple places. There's like, I think 7 branches. They stimulated the branch around the mouth to get it to move. And then they stimulated the paralyzed side. And as you'll see from these test results, there was barely a signal on the paralyzed side. My ear, nose, throat doctor wanted to do this to see how bad the nerve is, and it's pretty bad, to the point that he discussed a decompression therapy. Now, had I come in early with this ear, nose, throat doctor, he probably would have recommended a decompression surgery to relieve the nerve. But we talked about it. He said he's not sure it would do a lot of benefit at this point. And so I decided because, last thing I need is recovery from a surgery and that the odds of benefit are low, I'm going to stay steady for now. The other test that I got was an MRI. Now, if you've ever had an MRI, those things are crazy. Like you're in a tube, it's weird noises, kind of loud. I had some earplugs in, but it was funny. I was like, this is kind of disconcerting, and I'm not claustrophobic. Ironically, after the procedure, I asked the technician and I said, "Hey, how many times do people freak out?" He said, "About once out of 12." And the guy before me freaked out. So I had to go to my happy place and just kind of zone out. But my ear, nose, throat doctor wanted to see what was going on in my head. And here were the results. I will read them. See if you can make sense of them. Abnormal ill-defined enhancement at the fundus of the right IIC, which extends into the tibiatic and mastoid segment of the mitral facial nerve, and also extends into the vestibule and portion of the posterior and lateral semicircular canals in the basal term of the cochlea. Findings are consistent with the reported clinical history of an infectious, post-infectious inflammatory neuritis and labyrinthitis. However, follow-up would be prudent to ensure resolution and exclude any alternate etiologies. What the heck are these guys even talking about? You medical people are nuts. You guys have invented your own language. I had to run that through ChatGPT. This is what it told me. There's abnormal inflammation and irritation seen in the right facial nerve, especially in the areas close to the ear canal, middle ear, and inner ear. This inflammation extends to parts of the inner ear, including the vestibule, which helps with balance. Yeah, that makes sense. Some of the semicircular canals, also balance related, and part of the cochlea, responsible for hearing. The radiologist recommends follow-up imaging to make sure the inflammation goes away. Why couldn't they just write that? I guess they got to write their own language to each other so that none of us can understand what the heck they're talking about. But thank you, ChatGPT, for translating it. Again, nothing surprising here. I haven't talked to my ENT doctor yet to see about his interpretation, but it confirms what we saw is that there's a lot going on in my head. Not good. Let's do a palsy check. All right. I'm going to raise my eyebrow, close my eyes. Let's puff my cheeks, smile, whistle, frown. I am still, I think, 100% paralyzed from what I can see of my tests and this palsy check right now. Let's talk some other good news. I did reintegrate some supplements. I'm using magnesium, vitamin B12 complex, and some Chinese herbs, and my stomach's holding steady. So cross the fingers. Bad news. Well, we hit a 12-week mark. And many weeks ago, I showed you this chart that I read about in Fix My Face, which talks about the likelihood of full recovery based on the time of movement. At this point, I've had no sign of movement, and we just did the test, so you can see there was no movement by 12 weeks. And the odds of a full recovery are less than 5%, according to that chart in that study. I am not discouraged, but dang, that sucks. Status quo, all the nerve stuff is still there. The paralysis that we saw is still there. The hearing loss still is unchanged. The tinnitus. I do feel like the balance is getting better, but I think that is mostly through balance therapy, which is strengthening eye tracking as well as physical balance capabilities. One of the big insights of these last 2 weeks has just been the sheer amount of medical appointments. It's exhausting. In week 11, I had 5 medical appointments in 4 days. That included vestibular therapy or balance therapy, an eye checkup, a nerve test, acupuncture, and massage. Now, those last 2 are elective, but they definitely helped. In week 12, I had 4 appointments in 4 days. Vestibular therapy, also known as balance therapy. I had 2 doses of acupuncture and I got an MRI. This just adds up. It's I think week 11, those 5 appointments were probably more than 10 hours. And this is what sucks when you're dealing with an illness. It just takes a lot of time, which takes a lot of energy. It impacts my ability to work. Now, the good news is I feel like some of this is going to slow down, other than the stuff that I'm doing electively, like acupuncture or a massage. I think at this point in discussions with my doctor, there's not much we're going to do. In fact, we're going to probably wait 3 months before we talk again, just to see what healing can come. So that's good, is that I'm going to slow down. I will keep doing the balance therapy, which has been weekly. I'm going to continue to do acupuncture, although I think I'm going to just slow it down just for the sheer sake of time. And because I haven't seen tangible results, but I want to keep trying. That means I will probably have more time back, which is good because I can apply my energy to exercise and physical activities that might help with balance and just getting the body back into a more physically fit state, which I'm hoping will have a byproduct on the face. Emotionally, I get an interesting comment. And if you look at some of my earlier videos, you'll know the difference. I've had a lot of people that be like, "Oh man, you seem to be doing so much better." And I think it's because I'm talking better, my energy's better, I'm not walking with a cane, I'm walking a little bit better in general, a lot better in general, to be honest. But it's interesting because this is still the same. This is still very much paralyzed. I'm still having to wear the moisture chamber. I'm still deaf. I'm still having tinnitus. The best way I could put it is I'm doing a lot better than 2 to 3 months ago. 3 months ago, I was in the middle of my sickness. I hadn't been diagnosed. And then shortly after diagnosis, I was a wreck. If you go look at those early videos, you can kind of see how limited I was. So I am definitely a lot better then, but I'm a long ways from where I was 3 to 4 months ago. Like I was in pretty good health. I was exercising daily. So it's a mixed bag. I feel emotionally pretty good, but I'm also feel like unsatisfied with where I'm at. Like I'm not okay with where I'm at. I don't want to stop where I'm at. I need to get better. I'm still very limited compared to where I was. So while I'm very grateful at the progress I've made, I'm also unsatisfied with where I am and where I want to be. But as I look at the slow progress, I look at that chart which talks about recovery as I do some research, there's a chance that I may not get much better than I am now. More likely than not, I will get better, but I might not get entirely better. And one of the things I have to decide on is what do I really want? Not that I can control it, but I can pray for it. I really want the eye to get better, to be able to blink. And I want the balance to get better enough to where I could ride a bike and run. I think everything else I could live with. The nostril not breathing, the mouth being broken, the hearing and the tinnitus, believe it or not, I think I could work with that. I think after the eye and the balance, I'd probably get the mouth because I do a lot of presenting. It'd be nice to be able to be more articulate than I am. I've gotten pretty good with this side of my mouth, but I still have some issues with certain letters and it just still looks funny. And besides, look at this. That's just a weird smile. Just, it's not normal. Not that I'm a smiley guy, but maybe this is my lesson to smile more if I ever get my mouth back. Emotionally, my sister asked me a question while we were camping. She was worried about being more depressed. She was worried that I'd get more depressed with my inability to do exercise and those things that have been really helpful for me. I don't know if I have an answer other than, the progress has always been encouraging. It's not fast, but I do feel like there's a little progress every week. And with this progress comes encouragement. I've also learned a lot of patience. And that's just something you have to do with this type of a condition. Nerves don't get better quickly. They will heal when they heal, however they decide to heal. The last thing I think that's giving my spirit some optimism, I would say, is a spiritual element. In the book of Matthew, Jesus said, "Come unto me, all ye that labor and are heavy laden, and I will give you rest. Take my yoke upon you and learn of me, for I am meek and lowly in heart, and ye shall find rest unto your souls." I have felt tremendously spiritually blessed through this experience. Whether it's just some direct inspiration that I felt, the comfort, friends, family, it's been really powerful. Less so now. And I think that's in part because I haven't needed that acute comfort. But there's this baseline comfort, and I've continued to seek inspiration and sharing my feelings with God as I have them, seeking the power of Jesus in my life. And I just feel like I've been blessed and continue to be blessed despite the hardships that I've experienced. And that's one of the most amazing parts of this whole experience is the emotional and spiritual comfort and insights that I've experienced that have been really profound in many areas of my life. So I'm very grateful that I am not experiencing depression, that I'm not feeling anxiety by wearing this in public, that my face looks weird. I mean, part of it's probably my personality, but part of it is I just feel blessed. And people, in large part, are okay when you explain to them about facial paralysis. They're very nice. My neighbors, my family, my friends who are close to me have been more than kind and supportive and have been willing to do so many things that it's good. and I'm learning and I'm growing inside. Well, it's taking a long time for my body to heal. And so for that, I can't be discouraged. All right. If you like this video, like it, ask me a question in the comments, share it, and I hope that this is a benefit. Subscribe to the channel where you'll see more videos like these.